Hello, how are you? 5 days ago, I did a video on restoring hope in the Matatu community. I received questions and criticism where people told me, no, Matatu people community does not suffer from post-traumatic stress syndrome. But my main argument is that some of the behaviors they engage with are borderline of some mental health disorders. For example, when a conductor throws out somebody who does not have enough bus fare out of a a moving vehicle, or when they walk or drive on pavements, ignoring any other road user. Why are they so aggressive? Why are they so irritable? What is really happening to the Matatu community? The other thing is the accidents that take place, where a Matatu becomes a total wreckage and killing almost everyone. The driver is not there to tell the story of what was the issue, but as a social worker, I still maintain that we need to look at the stress that the Matatu community undergoes and how we can address that stress. In this video, I'm going to take you through a group therapy model for Matatu community in Kenya. And I'll start with what I said in the last video that Kedi Mutongi wrote a book in 2017 on a Matatu transport in Kenya, and she showed how they were aggressive, deranged, rebellious, and everything gone wrong in the country. They have even transferred that culture to other road users who aggressively also try to behave like matatus. And this is quite serious, especially where they throw somebody out of a moving bus. I'll continue by saying that most Matatu community members are a product of systemic marginalization and inequality in Kenya. They were rejected by the school system, they dropped out of school, they didn't have employment connections, so they had to go out and fend for themselves in the jobs that are easily available. That is at Matatu site, where they call out passengers, through training, eventually graduate to become drivers or become conductors. So if we condemn our, youth with this type of job, this type of programs which included dropping out of school, scoring poor grades, and of course, even while they are on the road and they see you taking your children comfortably to school in your car, remember their children somewhere are walking to school either in Githurai Kimbo, or Mwihoko, or such schools where their children go. So we can imagine how this systemic violation of rights, abuse impacts on the Matatu people or community who are very wounded. To say the least, Matatu's work is stressful. They start at 3 a.m. and end at 11 p.m. There are no seats at bus stops, toilets, or water facilities. They have no job protection. They are hired and disposed of at will. They are not unionized. They have no job security and are paid on a day basis. So a figure is set for them, is fixed for them to give their own, and after that, the difference, they pocket the difference. So that could be one of the reasons why they drive the way they drive, so that they can meet the owner's amount, also be able to pay themselves, and also be able to fill the matatu with a tank of petrol for the next day. The matatu community symptoms of PTSD include dependency on alcohol or substance abuse like ubero, miraa, muguka, cannabis. They engage in risky sexual behavior. Some have poor body hygiene, violence, inassisted, or use vulgar language. They are aggressive, rebellious, and breaking all possible rules. Fatigue and use of loud music, reacting to every situation. The Matatu community is exposed to traumatic experiences every day at the macro level, which include witnessing fatalities due to numerous traffic accidents. They drive on poor roads where bad drivers abound. There are no special lanes for them, for their vehicles. They encounter police and who extort money from them. And there's a indicative justice system which is not sympathetic with the Matatu community. And sometimes it's even hard to find out a Matatu community member finding a lawyer to represent them because the lawyers are out of reach. So what triggers the Matatu community? Carrying a busload of people in a minivan is anxiety-inducing. The lives of those on board depend on the driver. The minibuses are not well insulated because they are made from thin fiber optic material. The vehicles do not have airbags. The seats on the fans are squeezed with insufficient legroom between them, and seat belts are not factory made, increasing the risk of injury. Any minor accident is bound to be fatal, and the driver is the most at risk. You'll be the first to perish in the event of a head-on collision, or in the case of he hits another vehicle from the back. Due to the weak fiber optic material in the case a vehicle rolls, many people or passengers are also likely to die, and if the driver survives, he will always live with guilt. Due to the many road accidents, drivers witness many crashes with injuries that are enough to cause trauma. Fatality and near fatality pedestrians and cyclists also cause trauma. Pedestrians do not follow rules while crossing roads. Assault, robbery, threats, or weapon exposure are frequent because of the hour the Matatu community operates. And even after work, the Matatu community is not safe because you can imagine, like in Wedani Kahawa Sukari area, some of the Matatu community members park their vans overnight at the Shell petrol station. You can imagine them going back home at 11 or midnight to Wihoko or to the downsides of Wedani. These things, we don't consider how they impact on their life. So, before I develop the group therapy program, I'll assess PTSD for the Matatu community. I'll look for the following symptoms: depression and anxiety, substance use, insomnia, work or role impairment while driving, suicidal ideation or self-harm, like when they harm on moving buses, when they hit the body of buses, calling out passengers, you wonder why they don't feel pain. Other things I'll consider is irritability, obsession with things. I remember one Matatu was scripted that I'm good at doing all that is bad. Where do those philosophies originate? Impulsivity, panic, and medical. I also consider medical issues like pneumonia due to waking up early, petrol fumes, and back pains because of sitting for so long on the vehicle. Acute stress because of waking up early and concentrating in poor roads where everyone does not respect the rule of law. Now I go to the group therapy plan. The group therapy plan, lesson 1, you'll start by setting group rules for engagement. I'm assuming that I'll work with the community in their circles and I'll be able to crowd fund group, group rules by asking them to suggest the rules that we shall follow in this engagement of group and group therapy. Some of the things that I'll consider are full participation in the group, treating each other with respect and dignity, and practicing privacy and confidentiality, that as members of the group, they will not reveal or divulge any information narrated during the group therapy. The second lesson will be about orientation and safety immediate action. I will prepare the drivers by Matatu community by explaining to them the safety issues that they may take. For example, to call the police or to call the ambulance in case of an accident, how to drive safely, and then I'll also carry out medical evaluation to find out after, with the help of professional doctors, whether they have been injured, what type of injuries they have, do they have whiplash, have their spines been broken, or broken bones in their legs. I also guide them on red flags such as loss of consciousness, confusion, and severe headaches. And because of these severe headaches, confusion, and lack of consciousness, the Matatu community may be forced to keep alert by chewing meguka or chewing mira or taking over-the-counter drugs, or they may abuse substance abuse like mohuka and mira, and the severe headaches may be treated with painkillers that will numb them or affect their sensitivity or will affect their consciousness. So I'll interrogate them about issues of vomiting, weaknesses, numbness, chest pain, shortness of breath, and uncontrolled bleeding. Then I'll tell them the importance of calling ambulances to transport the injured. Then I'll call upon the quick removal of bodies from the road to stop further traumatization of other road users and other drivers, even children who may be walking to school. So I'll call upon the attendants to know that it is important to clear bodies as soon as they lie on the road. Then there is also need to clean the road of blood and grass so as to clear the symptom of clash so that any driver passing through there may not get a flash because of sighting blood or grass. And then the vehicles should be towed immediately. So NTCA should be prepared on the road and have mobile clinics that will work and orient the, the drivers with the safety measures and immediate actions to take. If the driver reports severe or impaired concentration, sleepiness, or on the panic, I would advise them not to continue driving, to take rest, arrange for secure transport, or the circle vehicle with another employee, inform the family, call relatives or the workplace to inform them of the accident. Ensure all passengers are checked by paramedic or medical professionals, even if they are not in pain. Police and responders need to be calm, practical, and judgmental. I find that whenever an accident happens, when people come around, as they usually do, most of them even want to beat the driver, burn the vehicle, because they blame the, the driver as having caused the accident. So we should be non-judgmental, treat them with respect and dignity, and ask them questions. Do you need med care? Who can be with you while attending to the driver? Do not use harsh language like you are driving carelessly or calling them kubavi to mess and cause an accident, or see the number of people you have killed wewe kubavu. Provide the basics like water, warm place, phone charger, and help with contacting family. Avoid pressurizing them to retell details repeatedly right away. The third lesson will be understanding the PTSD symptom triggers. The triggers, the triggers are hyperarousal, re-experiencing how symptoms affect sleep, relationship, work, and school. Others is at highways, intersections, or the hearing of braking sounds and sirens. Cognition ideas, feeling like I'm not safe, it was my fault, self-blame and guilt, fear of consequences, work impairment, isolation, substance abuse, and crash risk, or suicidal ideation while you're driving, and disassociation or blackouts while driving, uncontrolled panic, psychosis, cognitive impairment after an accident, freezing after witnessing an accident, marked irritability, hypervigilance, or intrusive memories. When a driver wakes up in the morning knowing the level of traffic accidents, it's hard to convince themselves that they'll come back home, safe and without fear. So, how do we reassure them? We can only reassure them by taking care of their emotions, teaching them emotional regulations. How do you regulate fear? How do you regulate anger? How do you regulate irritability? How do you deal with road rage and all that? Our lesson 4 will consist of stabilization and safety. This will involve decreasing acute arousal and panic, how to improve sleep and daily emotional regulation, how to reestablish motor control through trauma processing, paced breathing and progressive muscle relaxation, sleep plan, consistent schedule, control stimuli like alcohol, caffeine, cannabis, mogoka, miraa, and kubera. Help them with skills to address nightmare or address hearing or voices. Emotional regulation. Consider the event that created the idea and how do you erase those repeated thoughts. Staying in the present, managing flashbacks, dissociation, surfing, coping plans for high stress moment, managing panic-like skills, building daily regulation boots through control and focusing. Create a panic pull over safety, regulate breathing, or call for support. The fifth lesson will involve emotions, relationships, and boundaries. The community will be prepared on how to understand the role of emotions in driving, emotional regulation skills, and understanding moods. How do you regulate your emotions when you see children being taken to school while you has walked from your home to Morocco, or they walked from Kariobangi to Jiro Primary School? So how do you regulate? How do you feel when you see other children being taken to work? You had passed but had no connections to go to work. Then you see contemporaries driving their cars. All these things are bound to be triggers, and it is important that the drivers will learn how to stabilize, how we shall work with how to stabilize in group therapy, these feelings, how we work them out and appreciate. We also need to understand body reactions to emotions, anger, irritability. How do we build trust, communication skills, support, social support, boundaries, intimacy concerns, and attitude? For example, after shouting and calling out for passengers, sometimes the touts become discouraged when they see you are just standing at the bus stop. And what they will do is issue an insult, like move away from the bus stop, or why you look very angry, why and my Matatu is beautiful. So all those things come out of their voices because of frustration. And we need to understand how we can deal with that frustration. The sixth lesson would involve meaning making to prevent relapse prevention. So we shall help the Matatu community to identify personal warning signs, identify their stressors, improve sleep hygiene, identify when to seek help, build coping toolbox review, set growth and values, planning for next steps, seeking community support, practicing mindfulness, that is thinking, breathing, concentrating on one thing at a time, maintaining awareness in activities, like when holding the steering wheel, have no rush, treat movements in a slow and light manner. Pay attention to the smoothness of the steering wheel. Look at it, touch it, follow it with each turn of the wheel. So in this case, when you are holding the steering wheel, be in the present, feel it, understand it, and touch it and smell it. This will help you in relaxing, in concentration when you start to drive. The other one, lesson 7, is return to duty pathway. In this lesson, we shall discuss how, if you had an accident, how you will return to duty. This will involve a graduated return rather than back to full routes immediately. For example, take off duties, ride along or short local routes, daytime only, normal route with check-ins or full duty. Set fitness for duty criteria that emphasizing driving safety. Adequate sleep and alertness. No impairing medication. Ability to concentrate without panic. Physical ability to perform essential tasks. How to take, not to take risky methods. Understand your triggers as a member of the Matatu community. Sit in a parked car, engine off. Listen to your breathing. Listen to, watch people how they are. Short drive in quiet neighborhood. Slightly busier road routes. Left turns, intersections. Take care of them, left and right turns. When do you make them? Be relaxed. Night driving and when it is raining. You need to be more cautious when it's raining and when it's at night. Don't follow routes that have, where you crashed. Just try to avoid and take care of your thoughts by identifying the events that are tricking them. Lesson 8 will cover the medication option. Medication isn't required for everyone, but can help when symptoms are moderate, severe, or therapy access is limited. There are common guidelines of medications to be taken, and these medications can only be prescribed by a psychiatrist. These medications will take care of post-traumatic stress disorder, or they will help with the trauma nightmares in some patients. And when you are taking this medication, they impair alertness, and you have to take care not to drive. We shall also address common comorbidities in drivers, include screening and parallel plans for chronic pain like back pain, insomnia and nightmare, deal with substance use, and how to manage anger, road rage, or hyperventilation. So those are the 8 lessons that we shall cover in the therapy and the subtopics that we shall cover for the group therapy for Matatu community. Thank you for listening to me, and I hope you welcome me into your circles to speak to your drivers about it. There are resources available for mental health facilities at Mathare Mental Hospital. They are also available at Kiromoreen Clinic or Oasis Clinic. Just invite them, or you can go to the Department of Psychiatry in medical schools and work with them on how to restore order in our roads. We don't want our Matatu community to serve to be murderers or criminals. We want them to behave like normal people. We want them to help them navigate through their stress conditions. In conclusion, this is Jerry, and I'm happy under the programs of Ogewe Bereanya that knowledge lies beyond strength. With knowledge, you can overcome all. Don't lose the little you have because you have anxiety, because you are depressed, because of road rage or such things. Take care of everything. Take care of your physical and mental health. And as I said, you can consult Mathare Mental Hospital or Chiromolane or Oasis Mental Health Clinic. With that, I say goodbye. Until next time, when we'll discuss further how to manage the therapy. Thank you very much, and I hope you subscribe to my channel, like and share. And most of all, I would like NTCA to receive this message about the need for group therapy for Matatu people. Our road accident should not happen. We need not to be judgmental. We need not to be punitive. We need to accept them as human beings who are crying out for help. Thank you.